Welcome back to the latest episode of the Key and Mang audio experience. I'm your host, Mang, as always, and my fellow co-host, Key. Key, what's good?
What's up, Mang? How are you?
I'm good. How are you?
I'm tired, but I'm here.
Hey, we here. We here. I
Yes.
feel you. Tired's a good word for today. But real quick, our episode focus today, we're both two PTs, both deal with a lot of people who are going through different types of injuries. I'm currently dealing with one, and so the question for today was like, what would you be like as a if you were a patient and you were rehab? So that's I know you've been dealing with some shoulder rehab, and I've been dealing with my hand and my knee sometimes, but just wanted to spin it around and see what we think we would be like as patients and if we weren't PTs. So, Kia, I'm gonna throw it at you. If you were a patient right now, how do you think you'd be as a patient recovering from
Well,
injury?
I know what I would be like as a patient because I recently finished PT like a month and a half ago. But I'm definitely like very like eager, and I think I'm a little on the aggressive side when it comes to doing certain things. Um, so I was dealing with shoulder pain and a lot of overhead movements were hurting me. So they were like telling me to lay off of those for a certain period of time. And I wouldn't like do a full workout with them, but I would like try it like every other day, like see if it's improving. And I like kind of think because I'm a PT, so I think like I know like what I should be doing, but at the same time, I kind of think like I'm the exception to the rule. Like, oh, that doesn't apply to me. So I was going a little too hard at first, and then I was seeing that like I was having too many like flare ups and stuff. So that made me realize that I had to like dial it back in and actually be a patient and not try to be the PT all the time. So I definitely think I'm on the more aggressive side and try to push things a little bit. But if I was post op, I think I wouldn't be like that early on. I would follow like all my precautions, but as soon as I'm like cleared to do stuff, I think I'll like try some things out.
hmm
That would be me.
Did you tell your PT that you were trying extra stuff, or did you kind of just kept that to yourself?
Oh yeah, because we'll be at work. Like I'll be at work because I would get treated when I'm off the clock. But during the day, like I'll be rubbing my shoulder, like if my shoulder be achy, they were like, "What'd you do?" And I'm like, "I did push-ups or like I overhead press." And they were like, "Yo, listen." They tell me I'm the worst patient ever. Like I'm that patient I complain about.
Huh. Hmm.
Yeah, like like they just do too much. That's me.
Funny how that works, huh?
Yeah.
Funny how that works. Funny how that
what
works.
What about you?
I think I'll start with if I were something post-op, I agree. I think I would follow everything to a T, but I would be relentless with the with like range of motion and stuff and like trying to get it back as soon as possible. Because I'll see timelines and I'm always like I'm trying to beat the timeline. Like
Yeah.
if like with this with if I had like a ACL or Achilles and I said 6 weeks in the boot, I'd be trying to get out in four. I think that's always it's like a little challenge, little challenge to myself to try and see, all right, if I stick with it and I'm careful, like how fast can we speed this healing process? But I think I have a good understanding of when is too much is too much. So I would definitely follow the rules, but I think like you, I would try and test the boundaries a little bit. Um, and then I think as it got closer and closer to getting closer to return, I think I'd probably be like a little more hesitant because it's like now you're getting close to like returning back to full, and you haven't done that in 8, 9, 10, 11, 12 months. I think that's where it gets a little like the mental side of it becomes more important. But I think trying to get started on that early will help that later process. But God forbid, hopefully no catastrophic injury for anybody because it's a long process. It's not easy to go through. But I think for right now, for me with this wrist, I've kind of just been I wasn't supposed to be playing basketball a week after, like that same week that it happened, but I did. Played 4 games and landed on it a couple of times, but it's only because we was in the playoffs and it's my left hand and I shoot right-handed. So I had to figure out ways to adjust and stuff. But they told me I probably wouldn't make it worse if I kept playing on it and to wear the splint. But I couldn't wear the splint because I couldn't like catch the ball. I couldn't do it. It was too heavy or too bulky. So I was like, I'm gonna wrap it. I'm gonna try and keep it still and not fall on it. And of course, I find ways to find the ground, and it would like hurt for like a quick minute or two. So I go out, and then I come back in and finish it out. But I really had to adjust how I played. But I was trying to yeah, probably not the best idea. And then people ask me like what I do, like see me in the brace and stuff. I'm like, what'd you do? I was like, oh, I play basketball. And I'm like, they're probably like, why is this dude treating me right now? And he's he's out here not listening to what he's telling me to do. But I think you weigh the pros and cons, and you see, is it something that you'd be okay with dealing with the consequences? And I was like, if I make this worse, that's on me. That's 100% on me. And I was ready with that possibility of that happening, and I was willing to take the risk of it. So that's how I think that's how I've been as a patient so far.
I mean, at least you take ownership of it. I think it's interesting to see though, because you have all different types of patients. You have the patients I hate are the people that don't do their home program, or like they don't do anything outside of the session. I hate those patients. So you have those, and then you have people like us that do too much. And I feel like
Hmm.
it's hard for people to be like in the middle. I feel like people are either one or the other.
Yeah, but I think that also comes like for like when you talking about the end of the spectrum where people don't do anything at home. I put that on me, honestly. I'm like, I haven't showed them the importance of doing their home exercises.
Uh-huh.
But yeah, no, I think there are two very different ends of the spectrum, and I think um it's trying to get people to be more independent and take control of their situation and not be so reactive to everything, but try and figure out how they can speed their process along or different things that they can utilize to get themselves better. And I think that's what I try to do with mine. It's like, or with any kind of milestones. They tell me, you know what? The doc told me that should be better in a week. And I was like, there's a bone chip in there. What you mean it's gonna be better in a week? It's like it's a 4 to 6 week timeline for a bone to heal, typically. So I was like trying to get on that. I was like, all right, 4 to 6 weeks. I'm trying to be on that low end of that 4 weeks. But I'm at 5 weeks now, and it's improved a lot. But there's still certain things that bother it. But I'm just like, I just try and make it a competition with myself to see how far I'm willing to push and how fast I can make this recovery timeline go without making things worse.
Yeah. I think there's pros and cons to each. It depends on like your diagnosis, like what you're dealing with. I think like if you're someone that's not post-op, you can push a little harder and like be okay. But then when you are post-op and you're trying to recover, like pushing too hard may set you back
Hmm.
or may make things worse.
Hmm.
So it's a good and bad thing.
Well, I think that's where the education comes into. Like, you got to know, like, what you could be doing if you push too hard. And if you don't have that information, then you ain't gonna know. But
Yeah.
somebody got to tell you.
You know what I also find crazy is the amount of patients that have extensive surgeries and don't know what the rehab process is like, or don't know what they should and shouldn't be doing. Like they come to PT and then we're educating them. I'm like, that is wild. Like if I have a surgery, I'm gonna want to know every single thing.
Yeah. The amount of people that don't know even what surgery they had. Like, did I have a
Yes.
rotator cuff repair or just like a scope? I'm just like, yo, like, how? How?
You can't put me under the knife and not tell me, but yeah. The education piece is important. All
But
right,
yeah,
question for you.
what's up?
What is the one injury you would not want to ever have?
Achilles tear. I feel like I feel like it's something that you're so used to. I feel like with like a ACL tear, like shoulder labrum tear, like those are all long recovery processes. But with an Achilles tear, like you can't walk for like the first 6 to 8 weeks. You're in the boot. At least with the ACL, you got crutches and you're in the brace, but you can like put weight through it if there's no meniscus tear. But Achilles, you're like out. You're on the scooter all the time. Like I don't know. It's just the recovery process seems daunting, daunting. And one of my buddies, he went through Achilles repair during PT school. And watching him go through that, I was like, yeah, dog, this is different. This is a different recovery process. And especially with like I'm a like basketball player, I like to jump, and like having the trust in your Achilles to be able to jump up. I think mentally it's a lot more scary than to me than
Yeah,
any other thing. So I think Achilles for me.
yeah. I would say the same thing, and I would also say like I would rather have any like upper body injury than lower body injury. But like once it's your like I'd rather injure my arm than my leg.
Your right arm?
Doesn't matter. I mean, preferably be my non-dominant, but like if I had to choose upper body versus lower body, I'd rather injure my upper body. Because like at least
Yeah.
I can walk and stuff and move.
Hmm. Hmm.
Like I could use a grabber or something. You know what I mean? I can't use a stepper. Like, you know what I mean?
Yeah.
I
Yeah,
definitely rather do that.
yeah. If you yeah, I guess. Yeah, I would agree with that. I would agree with that.
But yeah,
Definitely.
I would agree on the Achilles repair because like I be doing single leg calf raises now and I be fatiguing out quick. Like it would take me
Hmm.
hella long to get my calf strain back. Like forget jumping. Like I just think that like that is probably not the strongest part of my body. I think I would do well recovering from like a upper body injury or like something at the knee, but
Hmm.
calf, foot, nope, no thanks.
Yeah. Look, I feel like it's time to put focus on some single leg calf strength, some calf lower leg rehab.
I have some in my program now.
Yeah, so you don't get dunked on.
Oh, I probably would get dunked on. Definitely. I would just move out the way. I would just move out the way.
And sometimes you don't see it coming.
Yeah, right. You been dunked
Sometimes
on
you don't
before?
see it coming. Huh?
You been dunked on before?
Almost. One time in one time in Fairbanks, we were like some of the basketball guys would come into our recreation gym and play, and there's a 6'7" dude coming at me, and I was like under the lane. So he went up and I like ran underneath his legs, but he missed a dunk. But I was like, oh my God. Oh my God. That was
Yeah.
scary. That was scary. But yeah, never like no. I try not to put myself in that situation.
Yeah, I don't have to deal with that with I didn't have to deal with that with girls.
Hmm. Yeah,
Nowadays you
no.
never know though, 'cause these girls be dunking. But
Hmm. Hmm. You
not
never
when I
know.
play.
They might, and someone might surprise you, and you're like, oh snap.
Yeah, right. I will hack them. They'll be at the foul line. They're not dunking on me. Guys got it bad though. I would be so not
Huh?
embarrassed, but I would need to dunk back. Like if I was a guy and I got dunked on, like,
Oh, for sure, for sure.
I need to get it back.
But it's like you just learn to like get past it. It's on to the next one. But
What
obviously,
if
it's
you
gonna be in your head. But you gotta do something. But like
what if you get posterized
I think
though?
about me like I'm like 5'8". I'm like, look, you 6'7", you supposed to do that. Like I ain't finna dunk on you. How am I gonna dunk on you? You gonna see it coming. So but I'm like, if you come out to the perimeter though, then it's a
You could
different
be Nate
story.
Robinson.
But yeah, but I don't know. It's a work in progress. A work in progress. We'll leave it at that.
Don't don't end up on a poster.
I
You
will
better
not.
dust your head
But
tops.
once people go through my program, then they can be the ones putting people on poster. How about that?
Exactly. Let's end it there.
Mm,
Boom.
yes. All right, we'll catch you on the next one.